Is it a big deal if my 2-year-old is not doing X, Y, Z? As a pediatric occupational therapist, one of the things I'm trained in is monitoring a child's development to determine if they might need just a little bit of extra support to meet their developmental milestones. So here are a couple of things that we want 2-year-olds to be able to do. And if your child is 2 and is not able to do these things, you want to bring this to your pediatrician. So I say this with the caveat that this does not mean that your child has a significant developmental delay if they're not able to do them. It's just something to keep your pediatrician in the loop on in case your child might benefit from a little bit of extra support like occupational therapy services. Obviously, if your child is not walking, we want kids to be walking by 18 months, so your pediatrician should definitely know about that. 2-year-olds should also be able to push a wheeled toy like a push walker, and they should also be able to pull a toy behind them while they're walking. If your child is walking but they've developed a pattern of significant toe walking, like they are walking on their toes more than half of the time, you definitely want to let your pediatrician know about that too. For your child's cognitive development, we want to see them following at least simple one-step directions. So at 2, of course, we're seeing a little bit of defiance. So they don't have to follow your instructions every single time, but is your child understanding what you're asking them to do when you ask them to do something simple like walk to the door? By 2, a kiddo should be stringing 2 words together to tell you what they want. Something very simple like more cheese is perfect. They should also be imitating you. I know my 2-year-old boys will both try to take my phone and go, hello, and they're showing an understanding of the way that things are used around the house, and that includes utensils and showing more success in feeding themselves with utensils. We also see a boom in language development at age 2 where a lot of 2-year-olds are saying hundreds of words. So if your child isn't doing any of these things or a lot of these things, just let your pediatrician know and start that conversation.